Hello, I'm Dr. Anjali Bhatawdekar. I'm a pediatrician.
Hello, I'm Dr. Manoj Bhatawdekar. I am a psychiatrist. In this series on parenting, we've been talking about food and food habits of children. And as usual, we have a question from a parent. Thank you, Varsha. The question says, my 4-year-old daughter gets tired excessively after playing and she looks weak. So, should I give her tonics?
There are two important statements in this question. The first is that the child is looking weak. Now, looking weak is a very subjective phenomenon. Parents who love their children want their child to look plump, as in advertisements. Also, parents get affected by comments of other people. So, if somebody says this child is looking weak, the parents are worried and anxious. So, they start worrying whether the child needs some supplements or not. Also, whenever the child is growing very fast in the height and the weight is not growing appropriately, then the child may look thin or weak for a short time, but later this will be compensated. So, looking weak has really no meaning. If a child is looking weak, go and get a medical checkup done by your doctor and confirm that the child has really lost weight or is not gaining enough weight, and then only maybe you need to do something about it. But the other part of this question is very important. This question says that the child is tired after playing. Now, if a child is playing for say 2 or 3 hours and then he gets tired, that's fine. But a child who gets tired after playing, even for a short duration, that is not a good sign. I'm worried about these children and we need to do a thorough medical checkup of these children. Many times we find that these children are suffering from anemia. Anemia is very common in young children, and the most common type of anemia is iron deficiency anemia. Iron deficiency anemia has two major reasons. The first is that the diet is inadequate in iron, and the second is that the child is losing some blood somewhere. Dietary deficiency of iron is very common in vegetarian children because there are very few vegetarian foods that contain a good amount of iron. So, vegetarian foods which are good in iron are your green leafy vegetables, especially drumstick leaves or dates. But obviously, the child cannot eat too much of this. But one good news is that if there is a lot of vitamin C in the diet, then whatever iron is there in the diet is absorbed well by the body. So, for vegetarians, it's important to ensure that a good amount of vitamin C, like lemons, is incorporated in your daily diet. For non-vegetarians, chicken and mutton are very good sources of iron. So, if a child is eating them regularly, then we don't really need to worry about the iron content of the diet of this child. But remember that eggs are not a good source of iron. Now, children who may have good iron in their diet still land up having iron deficiency anemia because the most common cause of blood loss in children is worm infestation. Worms in the intestine can cause microscopic bleeding. So, this bleeding is not seen by the naked eye by the parents. So, the parents are not aware that this bleeding is going on. But what we find is that the child keeps losing blood over a period of time, and later this child has iron deficiency anemia. Children who play bare feet in mud are very likely to get worm infestations. So, these children should be given a worm medicine at least every 6 months. Talking about tonics now. This mother is asking whether tonics would help this child. As I said earlier, this child is tired after playing. So, what we need to do is a medical checkup. And after the medical checkup and blood test, we need to decide what medicines are to be given. The tonics which are generally available over the counter, they contain vitamins B complex. Vitamin B complex is easily available in your fruits and vegetables and salads. But remember that B complex vitamins are water soluble. So if you unnecessarily give these vitamins as tonics, then they will be thrown out through the urine. It's like pouring this bottle down the sink. Unnecessary expenditure for the parents, and they just feel that they're doing something for the child, and actually nothing good is happening to the child. So tonics are not really recommended unless there is a specific reason to give tonics. So B complex vitamins will be needed if a child is ill for a very prolonged period, or antibiotics are going on for a long period. These children may need vitamin B complex. Or in our examination, sometimes we find that malnourished children have certain vitamin deficiencies. In that case, we have to give these specific vitamins to the child. But general tonics are not really needed just because a child looks weak. As regards the iron medicines which are there, they are specific medicines and they should be prescribed by your doctor. And also remember that iron medicines should not be given unnecessarily again, because too much iron can also be harmful to the body. So I don't think this child needs any tonics. What she needs is a medical checkup and medicines if required accordingly.